The Closing the Gap podcast is produced by the Association of Nigerian Physicians in the Americas and is supported by the association, sponsors, and advertising. Hello, everyone, and welcome to the Closing the Gaps podcast, brought to you by the Association of Nigerian Physicians in the Americas, also known as ANPA. My name is Jason Prater, and I'll be your host for today. The goal of Closing the Gaps podcast is to highlight and to share the stories of physicians and healthcare workers in Nigeria and in the United States and how they're helping to close the gaps in provision of healthcare services to people who need it the most. We will also be thanking our guests for their tireless work, finding out what other steps they wish to take in the future, and to help make healthcare more available to everyone, and of course, how we can help too. Well, welcome back to Closing the Gaps podcast. We are super excited today. We have Dr. Aluko here on the line. We are going to learn more about him, more about his profession and what he is doing to close the gap in healthcare worldwide. And so, Doctor, welcome. We appreciate your time. We appreciate the efforts that you're giving to this. And so please introduce yourself and let us know a little bit about you.
Thank you, Jason, for the opportunity to share thoughts with you today. My name is Dr. Yele Aluko. I am a Nigerian-born and Nigerian-trained physician. I went to Ibadan Medical School, and after that, I obtained specialty and subspecialty training in cardiovascular medicine and in interventional and structural heart cardiology in the United States, where I currently am. So I am a US-based physician executive. I'm a health industry strategist, a health systems corporate advisor, a global health influencer and leader. I currently serve as Chief Medical Officer at the global health consulting firm called Ernst & Young, abbreviated EY for short. I'm also the director of the EY Center for Health Equity. I practiced cardiovascular medicine in the United States for 23 years, up until 7 years ago, after which I joined industry as a management consultant. And in the work that I do, I advise health system C-suite clients on strategy, business operations. I also provide insight on mega trends confronting the health industry in America to best position our clients for competitive advantage in the market. Part of the work I do involves global health development, and I am a global health development leader at EY. Additionally, I mentioned that I'm the director of the EY Center for Health Equity, and in that role, me and my team, we advise our clients in the US in regards to developing competencies and solutions to close disparity gaps in the United States. But that work has extended across EY's other global practices in the UK, in the Middle East, and in Australia. So I am privileged to have this conversation with you today. I will say that having gone to business school about 14 years ago, that additional lens into the industry has given me an understanding of health industry optimization strategies and gives me an astute understanding of the complexity of the health industry ecosystem on the African continent in general, as well as in Nigeria in particular. So that's me in a nutshell. I'll stop there. And
Well, Dr. Aluko, you have accomplished a lot. Let's go ahead and say that. And first off, let me say on behalf of Closing the Gaps podcast and AMPA, thank you very much, Doctor, for your service. But I have a quick question for you. So, in regard to closing the gap with healthcare, where you recognize from Nigeria to America, I would love to hear maybe if you can give me a brief section of a story that has impacted you both here and there.
well, a story that impacted me in Nigeria. I was born in Lagos. I went
Yes, sir.
to primary school and secondary school in Lagos. The most impactful story that I can share with you is the story that led me to become a physician. And
There you
it
go.
was
Beautiful.
when I was about 15 or 16 years of age. My mother took me to go visit with her, a relative of ours, at the Lagos University Teaching Hospital. As we parked our car in the parking area and walked through the emergency department, I heard a taxi screeching into the emergency area, and four doors were flung open. The taxi driver runs out, opens the back door. The passenger in the front seat runs out. Gentleman says, "My wife is dying. Please help me." He
Mm,
rushes into the
wow.
emergency room, and the emergency room was very busy. Nobody could help him. He rushes out, and the two men carry this woman in their arms into the emergency room and put her on the floor.
Wow.
Eventually, she gets put on a stretcher. They give her first aid. Long story short, she died. She died
Mm,
there, right in front of
yes.
me. And
Yes, sir.
as a young man, that was so impressionable. And it actually led me to develop an interest in saving lives. I had,
Wow.
at a young age, the altruistic intention that nothing like that would happen to a family member of mine.
Wow.
So most
Wow.
people who go into medicine have some impactful reasons why they do so, either personal experiences or experiences through family members who may be in the profession. There are many impactful experiences. And in America here, there are several. Some of them are sensitive and some of them
Sure,
are
sure,
less
sure, sure.
so.
Yeah, absolutely.
I will say that when I was an interventional cardiology fellow in Massachusetts several years ago, having been a fellow for 6 months, doing pretty much 80% of the sophisticated interventional procedures at the time called angioplasties, I realized after 6 months that I had done a procedure on only one black person
Mm,
in a
mm,
city in Massachusetts that was a blue collar city that had at least a 35% of black people. And
sure.
I began having questions at that time as to why is it that I, as a black specialist at the pinnacle of a pyramid, having the most sophisticated training available in America, why were my skills not extending to the African American community in a
Mm,
manner that was equitable?
sure.
And that began my exploration into the complex ecosystem that drives health disparities within vulnerable populations in the United States. And that demographic of vulnerable populations include several subpopulations such as race, gender, ethnicity, the elderly, the disabled, women of all races,
Mm,
the homeless, different sexual orientations, people living in rural versus urban communities. And that led me to become a health equity practitioner throughout my career. coming to EY, I had no realization that I was going to be leading a line of business that I started, the EY Center for Health Equity. But that came out of our experience in COVID, when all of a
Sure.
sudden the world began to understand that
Yeah.
different populations had different experiences and different outcomes, even if they had the same type of health insurance.
Right.
So
That
there's
was big
several,
for
but
everybody.
those
Yeah.
two I think should suffice.
Absolutely. And doctor, first off, thank you. Thank you very much for your service, your dedication. Um, when I sit here and I think of this, I do know we've spoken to several individuals who are younger, generations before us, generations of individuals who are seeking the profession of healthcare, and their heart beats what you just said. And so, if you wouldn't mind, what I would like to say is this. So, Doctor, you shared a couple of stories, and one of your stories for me was very profound. It was very heartfelt. And you experienced something where it made you capitalize. And you said, hey, I want to do the best that I can to help my people. I want to help my people. I want to help people abroad. And so, if there was an individual, let's say there's a college student right now who's listening to this, and as you being a seasoned doctor, if you wouldn't mind, would you give them maybe a quick 30 seconds word of encouragement and tell them about, hey, even though this is very hard, this is a hard thing, you can make it. And if you could give them 30 seconds, would you do that for me right now, please, doctor?
Well, absolutely. I have and continue to have mentees that seek advice in regards to career decision making in the health industry, as well as they progress through their professions. So I will say that first of all, if you want to do medicine, you have to understand within you that it is a profession and a vocation of service to humanity. Now,
Wow.
all
Beautiful.
professions bring
I love that.
value
Yes.
to consumers. The health consumer is inappropriately called a patient because I say that because there are people who are health consumers that are healthy. They're not patients, but the industry refers to health consumers as patients. Their industries in general bring value to their stakeholder groups. In healthcare, every single day, a doctor or a nurse practitioner or registered nurse or nurse's assistant wakes up in the morning, puts on their nurse's uniform, puts on their doctor's coat, opens their front door, gets in their car or
Mm,
gets in public transportation, and they
right.
go to work
Right.
every single day without equivocation. They are helping people live longer.
That's
They're
right.
helping people
That's right.
feel better.
That's
They're
right.
helping people and their families understand the importance of dignity in death and the ability to transition with
Mm,
dignity.
mm.
Now, that is unquantifiable human value that you
Yes, sir.
cannot codify in monetary terms. And I
Absolutely.
don't want to minimize the value of any other industry, but doctors and nurses and healthcare professionals do that day in and day out.
Well, you help provide life.
That is
That's
correct.
life.
That
That's
is
life.
correct. But I also want to emphasize that the health industry goes beyond bedside work. It's not
Absolutely.
doctors and nurses and patients. People that want to consider medicine should also be aware that there's a broad competency adjacencies within the industry from healthcare administration,
Mm,
people that can run hospitals,
yeah.
medical education, academic medicine, healthcare technology, healthcare consulting, healthcare innovation. So there's public health as well. And then there's also the other sectors apart from hospitals, such as the health insurance industry, the biopharma industry for research and development of drugs, the life science and medical device industry that innovates new devices that help patients live better and live longer. So
Absolutely.
it's a broad opportunity, and I encourage my mentees not to get locked into anything right now, but to understand, explore, and then gravitate to their best affinity point.
There it is. And doctor, please forgive my intrusion, but I loved what you just said right there. My mentees. Okay. So, fellow listeners of Closing the Gap podcast, we right now have a seasoned doctor. He is capable of helping individuals, not alone from his team, from his profession, but also for individuals that are maybe seeking to get involved within this field. And so please, doctor, if you wouldn't mind, 2 seconds, let us and the listeners know maybe some contact information for you. If you wouldn't mind, because you seem like you're a leader of leaders. So if you wouldn't mind, please share maybe a website address, an email address, or a phone number to where maybe somebody who is going to one day look up to you and say, hey, if this doctor did it, I can do it. This is tough, but you know what? I see it as worth it. What would you say to them right now, as well as sharing your information?
Well, I generally welcome the opportunity to be available for people who are seeking insight, particularly if my experience can enrich their potential.
Yes,
My
sir.
email address is my first name, which is Yele, Yele, dot. My last name is ALU, as an umbrella, KO. That is Yele.aluko at E as in Edward, Y as in yellow.com. Probably best you send me an email if you want to reach out to me. I will guarantee you that I will respond. My cell phone number is not predictable because it has a robo-killer filter. So if you call me and you aren't in my directory, it will not get through. But emails, I'm pretty good at emails.
Awesome. Well, listeners, please, all of my fellow Closing the Gap participants, everybody who is tuning in, we have a very prestigious doctor on the line, an individual who is sharing not alone personal, but also professional things that have taken place to help him arrive where he is at. Hard work, dedication, seeing what's taking place in Nigeria, seeing what's taking place here in the Americas, and he is somebody who is helping to stand and to close the gap in healthcare. And so, doctor, on behalf of Closing the Gaps podcast, on behalf of ANPA, we thank you so much for your time. We thank you for your wisdom. And listeners, please make sure that you hear this information and reach out to this individual. We thank you so much for tuning in and hope you have a great day.
Thank you for your time. Thank you.
At this point of the show, we're going to be taking a break and we're going to come back very shortly to meet our next guest. Please stay tuned.
Have you ever considered plastic surgery? Do you have poor self-image or body pain due to excessive skin or fat? Do you consider professional cosmetic plastic surgery provided by Abuja Plastics? Besides concealing aesthetic physical flaws, cosmetic surgery has several physical and mental health benefits, including increasing one's self-worth, self-esteem, and overall quality of life. At Abuja Plastics, we specialize in facial rejuvenation, breast enhancements, and other contouring procedures such as liposuction, tummy tucks, fat transfers, and mommy and daddy makeovers. Our office is located at 276A Kofo Abayami Street, Victoria Island, Lagos, Nigeria. Visit us online today at www.abujaplastics.com or email us at info@abujaplastics.com. ANPA Closing the Gap podcast listeners can get 5% discount on surgery fees and 10% off spa services when they mention the Closing the Gap podcast. Get your nip and tuck today at Abuja Plastics. M&G Etome Foundation provides skills acquisition programs, graduate HSE programs, and community sports and recreation programs for impoverished youth in the Port Harcourt area of the Niger Delta in Nigeria. Our goal is to break the harsh cycle of poverty in these rural areas of Nigeria by teaching the value of self-empowerment and improvement through our various programs and activities. To find out more about what we do at M&GE Etome Foundation, visit our website at www.mgesolutions.org. We also welcome your donations, support, and sponsorship also. Together, we can facilitate positive change and programs of sustaining development of youth in the Niger Delta community.
Today on our show, we have two very special guests. I'm super excited about this. We have Dr. Ben and Mr. Omar. We have the CEO and COO of the First Patient Engagement. And so, gentlemen, welcome to Closing the Gaps podcast. And if we can start first with you, Dr. Ben, I'd love to hear a little bit about you, your position, and what you are doing to help close the gap in healthcare.
My name is, like you said, I'm Dr. Ben Okwara. I'm an internist. Been in practice since 1994. First Care opened 1994. Been there for almost 30 plus years now. What we've done to close the gap in healthcare, what prompted me to start First Care is to, we have a lot of patients to give easy access to patient care, and especially for the underserved population, that's what we serve. And, for the underserved population, they suffer more end organ damage. We've been able to prevent a lot of preventable end organ disease like heart failures, chronic renal failure, and, prevent the complications of diabetes. By doing that, we prevent unnecessary admission to the hospital, and that's what are the impacts. What we've done to close the gap: easy access to care. Patient don't need an appointment to come and see us. That's what we've done within First Care.
Wow, Dr. Ben, that's incredible. And so, as you being the CEO of this organization, how important is it to you, your company's culture? And what I mean by that is, as you help oversee several different teammates within your organization to get these goals done, closing the gap in healthcare, the things that you need your organization to handle, how important is that to you personally as being the individual who is in your role as the CEO?
In healthcare, the most important part is communication or engagement of patients.
Wow.
It's been shown the more you engage patients, the more they'll be more compliant with taking their medication. They're more compliant with their medication. They'll follow up with their providers more. And what we've done within FPE, First Patient Engagement, is calling patients, reminding them to take their medication, making sure they go for their appointments scheduled by their PCP, making sure they refill their medication when it's needed, and prevent them from taking the knee-jerk reaction of if they can't reach their provider, they wind up in the emergency room. That's when you go to the emergency room, the people that see them in the emergency room don't understand their chronic medical problem or what needs to be done. And when they see their provider as scheduled through what we do at FPE, it allows them for easier communication and easier access to their provider and all the referrals that is made by their provider. That's the key thing. And kind of takes away the burden for the provider not to worry about if a patient is going to make the appointment or not. That we take over that headache from them.
That's good. That's good. So as being the chief executive officer, what is a goal that you have right now for FPE?
The goal that we have for FPE is to be able to export what we have done well for first care. What we've done well for first care is been shown. The biggest cost in healthcare today is patients not being compliant to their medication, going to the hospital. The goal that we have now, see how we can export the success we've had with our clients to other clients across the country, within the North and South Carolina and the Southeast and the rest of the United States. That's our goal.
That's awesome. I love that, doctor. And how long have you been a supporter of ANPA, the Association of Nigerian Physicians in the Americas, sir?
Since 1995.
Awesome. Awesome. So you love the organization. You see the impact of what they're doing as well, the partnerships between the two of you. And we have interviewed everybody from the college student to a doctor or physician to all kinds of different backgrounds. But let me ask you, as a man who has reached an executive level, if you wouldn't mind, share with maybe some listeners that are younger that their hope and desire is to reach a point in life where you're at. What is something maybe you failed at, but you learned from?
That's a good question.
That's a good question, isn't it?
What I failed at is the fear of failure. The fear of failure. What I've learned from the fear of failure, the only time you fail is when you stop trying.
Right.
Yep. That's my biggest fear. And anything that you're doing, like my father would say, if you're not scared, there's something is wrong with you. But when you press on, you overcome that fear. I don't really see failure as an obstacle, and that's what I've been able to impact with a lot of young physicians or potential physicians or PA or nurse practitioners or nurses, for them not to worry about failure. That failure it should be a learning experience for you. The great time you fail is when you stop trying, and there's really no substitute to be determined and remain focused. Everybody have failures. You don't want your failure to impact your thought process or why you move forward in life.
That's right. And, I love everything about leadership, and I'm sure to a degree you do as well, to be where you're at. And one of the things I have learned over time is that individuals that are in executive positions provide an opportunity for people to fail because it becomes a growth opportunity. And so for any listener that may be going through college, is involved in school, or you are currently an intern somewhere learning or growing, hear what this man is sharing you, because what we know is wisdom is power, right? And I'm sure, doctor, you can go ahead and say that is a truth. And so is you're sharing what this is, but let me also hear, what is one of your most memorable times that you've had?
I mean, in my profession or in life as a whole?
I would say let's do both. Let's try your profession and then also in your life, because you know what? We want to be able to look at what is a person who's in this role that's involved in healthcare, but then also in your own true life, what has also helped you to succeed in that? So sure, let's answer both of those if you don't mind, please, sir.
I think most memorable thing is when you're growing up in Nigeria, you have a dream to be somebody. And having that dream come to pass. And once you achieve that dream, you set another goal for you. You want to say, okay, now you want to be able to start something that's going to impact people's life. And being in a profession where you affect people's life and people come and say thank you. And I think is the most gratifying thing in the world is the impact, how you affect your patient's life. And they see you make a positive change for them and they appreciate you and they love what you do. And being able to influence other young kids to follow your footsteps. I've had so many kids that's intern under me. They're doctors now. They drop by. When they're in diapers now, you see them. They're doctors, or they're in college doing something very good for themselves. I think that's very being able to affect people's life is very memorable for me. And for what you're doing at FPA, now is going to make it have more impact for other people coming behind us.
So what you're saying is maybe raising up the next generation of leaders.
Yes, affecting the next generation, so
Right.
knowledge is not your personal property. You have to share your knowledge.
Absolutely.
To pass it on to other kids.
Absolutely. I love that answer. And so, doctor, talking about closing the gap in healthcare. So not alone have you been able to capitalize on this, but now what you're saying is your heart is to help raise other individuals up who can continue to do it, right?
Yes.
That's awesome. That's awesome. And that's what separates, I feel like, sometimes leaders from an average person. And so, Dr. Ben, just briefly before we get into this, and I'm going to allow Mr. Omar to share on this as well, too, and then y'all together as FPE. But how can somebody, if they maybe have a question for you, if there's another organization that would like to partner with you, would you be willing to share maybe your email address, a website address, or even your contact phone number for the listeners that are here today that are very interested in speaking?
Omar, can you?
Yeah, absolutely. The Dr. Okwara and I both are very, very fond of people just going ahead and contacting us right on our telephones, right? So we definitely would like to give that out to the listeners first, because that's the fastest way to get straight to it, right? You get straight to your answer by contacting, Dr. Okwara and I quickly. So Dr. Benedict Okwara, his phone number is area code 704-604-8104. And mine is 704-561-1065. We also you can also reach out via email. We have our contact form if people want to use that email. That's a catch-all. The reason we have that is all of our leadership has it, just in case we're in the meeting or something. It's the best way for people to get back with everyone in a quick time frame. And that's just simply contact@firstpatientengagement.ltd.com. And again, that's contact@firstpatientengagement.ltd.com. We're doing a brand new refresh and rebrand of the website. We got, just like with anything, it's like the NFL draft. We got some new young talent in. They have some great ideas. So we infused that new innovative idea. So we're rebranding the website as well, which is just firstpatientengagement.ltd.com. But again, we definitely recommend send us an email, give us a call. We are more than willing to have the conversations and connect with anyone who wants to follow up with us.
That's awesome. That's awesome. Dr. Ben, I want to say thank you so much for sharing your heart. And Mr. Omar, as you being COO, right here, we had a very perfect example of what a COO is, and you are a backbone. And so as being over people, as helping serve and doing the things that you do within your organization of FPE, I would love to hear a little bit about your heart and what it is that you do in your role for your organization.
Well, first of all, thank you again. Thank all the listeners for giving us the opportunity to just, be. My role, I always say COO and the CEO, one focuses on tomorrow, one focuses on today.
Right. Yes.
That's
absolutely.
That's that handshake. And when that handshake is firm and tight, both people can perform at a high level. And when Dr. Okwara and I co-founded First Patient Engagement Center, that was one of the first things we sat down and decided was where are we strongest at, right? No different than a great head coach and a great quarterbacks. One person has to come up with the game plan and someone has to go out there and execute said game plan, right? So that's who we are and how we work together. And my biggest passion is getting patients to that very thing so that they can enjoy the quality of life that they envision for themselves.
I love that.
That's number one for me, right? I will stay up as long as I need to stay up. Whatever needs to be done in my role as a part of this team, I will make sure I do so that people, because you can't define someone's quality of life, but what you can do is be a participant to provide them with the resources so that they can achieve said goal. And that's what we're trying to do here at First Patient Engagement Center. Work with the practices so that they can help increase the access to healthcare while reducing the cost, while patients then can live a healthy lifestyle with minimized episodic issues with any of the chronic conditions that they're dealing with.
Omar, I love it. I love it. And so I think I kind of already got a taste of the next question I'm going to ask you. But what is your leadership philosophy? And I've heard a little bit of it, I feel like, in what you just said. But from your day-to-day grind, what would you say your leadership philosophy is and what you do to help close the gap in healthcare?
Well, leaders eat last.
Come on. That's
Leaders
right.
eat last. And so the first and foremost thing is that my role is to take care of the people internally so that they can take care of the clients.
Wow.
If I
That is a
focus on
perfect
taking
answer.
care of our team, they can do a great job of taking care of our clients. So that is what I walk in the door with every single day. Take care of our internal team, and they will do a phenomenal job taking care of everything external.
That's right. That's right. Because it's like the old saying, there's no I in team, but nowadays they say, but there is in us, that if we have a team that is built, not one person of the organization can make sure everything is good. But if we have a dynamic of leadership from the person who answers the phone all the way up to the founder, the president, CEO, COO, if we have this communion that is perfect, then you're reaching the most you possibly can, right?
Absolutely.
And so let me ask you a question too. Also, once again, for the listeners, and once again, just sharing, because recently we've had everybody, gentlemen, from individuals that are in college right now, aspiring to be in a position in healthcare or a position of leadership in healthcare, to everything in between. What would you say for you? When you look at maybe say your day by day, you have to calculate your day. What would you say is a big goal for you to make sure you maximize your efforts for that day?
I will say you can celebrate the wins, but learn from
Mm,
the losses.
mm. Okay. And I love that. And Dr. Ben earlier said something, and now you're correlating with it. And I have done just a ton of research in regard to just leadership in general. But once again, it's welcoming a loss. It's welcoming a
Yep.
failure, not saying, hey, you need to walk in failure. But when you make a mistake, what a man, a woman, or leader does is rise back up, learn from their mistake, and grow. Right. And so welcoming that, because it helps make the people that are on you guys' team be the best they could be. Would that sound fair?
Absolutely. The
That's
the
awesome.
the loss is the thing. I equate it to a toothache, right? Growth is painful, and you're never going to be prepared for it because it's new. That's why a
Mm.
toothache hurts so bad when a new tooth comes in.
Right. Right. Yeah. That's right. That's right. Okay. Well, one last quick question, and just specifically towards you. How are you making healthcare more accessible? How do you feel like you personally are helping to make healthcare more accessible?
So again, I will say that through the services that First Patient Engagement Center provides, it gives duality. And what
Uh-huh.
that duality is it allows independent practices to stay engaged with their patients through things like chronic care management, remote patient monitoring, working on their labs and referrals, and just overall communication engagement, while subsequently and simultaneously working with that patient so that again they're getting their medications, they're getting that follow-up, they're getting those referrals, they're getting those appointments, they're getting touch points and touch bases, blood pressure checks every single month so that
Mhm.
their lifestyle is now healthy. When you combine those two, what happens is that the cost of that individual's healthcare goes down, while at the same time the
Oh, wait,
independent
let me
practice.
interrupt you. I want you to
Yes.
repeat that real quick. And I'm sorry to interrupt, but I felt like that was such a key point. All right. If you'll just repeat what you just said.
By providing those services, the cost of the individual's healthcare will go down because they're
Mm,
compliant, they're getting the things they need, their quality of life is improved, and their urgent and emergent needs not at the forefront. And then simultaneously, the medical independent practice, they are then still providing ethical, high level care and they can be reimbursed fairly and equitably so they can keep a healthy business running while meeting the standards financially, ethically, and quality of life for their patients to meet those needs.
Mr. Omar, I think that was phenomenal. And I'm just going to admit I lied. I want to ask just a little bit more to you. So I've got two other things, just real quick, if you wouldn't mind, please. So if you can just once again state what services specifically are y'all providing for the listeners. So both of these questions, this one I just asked, the next one are going to be specifically for the listeners. So what services do you provide?
So First Patient Engagement Center partners with independent medical practices to provide chronic care management services to their Medicare population patients, remote patient monitoring to their Medicare population patients, and that includes commercial, Advantage plans, traditional Medicare. We also provide patient-centered management, and then we provide something that's called patient navigation services, which is we take all of the phone calls for the medical practice. We do all of the referrals for the practice, all of the abnormal labs for said practice, as well as a system on things like prior authorization. So we become a plug-in component through the level of capacity that we have to be able to provide all of these, what I like to say are siloed services, but that have become pretty valuable and needed so that independent practices can stay alive.
Awesome. And so listeners, please pay attention to what these gentlemen are saying. And last thing, as a little bit of a sign-off note, Mr. Omar, if you have the person who would be, say, a college student or a physician that is struggling right now because of the day in, day out hustle and bustle, if you could give them an ounce of encouragement, what would that be, sir?
I would. The encouragement that I will give is the patients in which you are caring for appreciate what you are doing, but the system is designed with landmines so that you can't get them to where they need to be. And First Patient Engagement Center is here to be your partner to not just remove the landmines, but build a road to prosperity.
Wow. Beautiful. And so, ladies and gentlemen, listening to Closing the Gap today, we have heard from two monumental individuals who are involved in healthcare. And so, as a final point, Mr. Omar, please, once again, to share y'all's contact again for the listeners. I just really want to make sure this is out there for anybody who is tuning in so they can really contact you guys, company, partner with you, whatever it is. So if you wouldn't mind, just one more time, please. Lay that out for the Closing the Gap podcast. Also, maybe where you're located too, please.
Yes, absolutely. So again, Dr. Okwara and I would really enjoy if anyone would like to reach out to us. We are accessible. You don't have to go through assistants and things of that nature. His phone number again is 704-604-8104. I repeat, 704-604-8104. I can be reached at 704-561-1065. Again, 704-561-1065. And the best catch-all email that way all of us can see all of our leaders, and to include Dr. Okwara and I, that is contact@firstpatientengagementltd.com. firstpatientengagementltd.com. contact@firstpatientengagementltd.com. We're located, our corporate headquarters are in Monroe, North Carolina at 404 South Sutherland Avenue. 404 South Sutherland Avenue in Monroe, North Carolina. So really, if there's any local listeners in Charlotte, you stay right on 74, you run right into us. So very easy to get to us. We have several other locations, but that's our corporate office. And we would love for anyone who wants to have a visit or a video, we would love to visit with you.
Awesome. And as a fellow North Carolinian, I'm from Durham. I just say thank you, gentlemen, so much for your services and for everything that you all do. Thank you for what y'all do day in and day out tirelessly for helping to close the gap in healthcare, serving, being examples, being leaders, being encouragers, and going above and beyond. And so on behalf of the Closing the Gap podcast, I just personally want to say thank you to both of you gentlemen today.
No, thank you as well. I would like to thank ANPA also. I've been fortunate enough to go to the last two ANPA events here, and it was phenomenal. So I just want to thank ANPA because they've just been extremely welcoming to be a part of the events that I've been able to go to. So I wanted to say that, and just many thanks.
Thank you for having us too. We appreciate your invite, and thanks to ANPA. We're here to help our fellow physicians.
Awesome. Well, once again, from our hearts to yours, thank you, gentlemen. Continue to do what you guys are doing. We are on your side. And ladies and gentlemen, once again, thank you for being a part of Closing the Gap podcast. Thank you for being a part of hearing about first patient engagement. And we will be continuing short.
Thank you so much.
Thank you.
Thank you for staying with us till the end of the show today. This has been the Closing the Gaps podcast, brought to you by the Association of Nigerian Physicians in the Americas, or ANPA. Remember to follow us on Facebook and other social media platforms. Our social media handles are as follows: Facebook, ANPA National; YouTube, ANPA 8415; Instagram, ANPA_National. You can also visit us at www.anpa, that's ANPA.org, for more details about up and coming events. Finally, remember to join us next week for our Closing the Gap podcast, where we'll have a whole new set of guests doing amazing things to close the gap and make healthcare services more accessible to people in Nigeria and in the United States. Once again, my name is Jason Prater, and it has been a pleasure being your host today. And until next time, stay healthy and have a fantastic day.